exactly should physicians and other healthcare providers work differently with people affected by chronic conditions?
Well, I think most of us, myself included, have been trained in that acute care model. The model that I like to call the find it and fix it model. What's the problem? How are we going to solve the problem? And that doesn't work very well for chronic conditions. It works great for a strep throat. It works great for trauma-related injuries, but it doesn't work great for chronic care because we have people with healthcare problems we can't fix, they can't fix. So we've got to use a different approach, and that approach focuses on, first of all, the consistent delivery of evidence-based care. We have to understand how to reduce mortality, how to reduce severity of illness, how to manage that disease over the lifetime or career of that patient over time. So we want to make sure that they're getting the right care. Number two, it's important that they take their medication, so we focus on adherence. Adherence is something that should be checked every time. If you're a physician, if you're a nurse, we want to make sure. Half of patients don't take medications, and the medications that are prescribed, and they're not quite sure how to take them, and they might be uncomfortable with the side effects. They might not, for a number of reasons, be bought into the treatment plan. So that's important. We also need to focus on self-management support, and that's much different than patient education. We're all familiar with patient education, handing out the manuals, the talk with the diabetes educator, but what we're really focused on is preparing people to better address the day-to-day issues with health. People are not, patients aren't concerned about optimal medical therapies or A1C levels, or if they're on an ACE, if they're on an ARB. What they're concerned about is solving the daily problems that their health conditions cause. Think about the chronic diseases. I have low back pain, so what am I concerned about? Can I do the things, exercise? Can I do things that I do in my leisure time, in work, day to day, that make me happy? That's what people are concerned about, and so that's what we need to focus on, healthcare providers, to really help people be more successful in their day-to-day lives and organize their healthcare around that. And that's a much different approach than the typical acute care model. And I think that we have to, as healthcare providers, I think we've got to take some pressure off ourselves, because this is very difficult work with, working with people with chronic conditions, because all of us, we want to help, we want to fix it, and people oftentimes will look to us to fix it. And if we get caught in that trap, it makes it very difficult, and it actually isn't a very effective way to work. So we have to empower people and help support them in the management of their own chronic diseases. That's key.